My name is Nicholas Katowski. The pathology that I'm going to be talking about in this video is osteoarthritis, otherwise known as OA, and the activity limitation that I'm going to be both demonstrating and discussing is sitting in a chair and standing up from a chair as well. So I'm sitting in my chair now. It's set to a normal height, and I'm just going to demonstrate the movement, what it would look like for a normal individual. So in the chair here, you're just going to want to position your feet so they're vertical, shoulder width apart, giving yourself a nice wide base of support, leaning the trunk forward and utilizing, on this chair there's armrests, but utilizing the armrests to use both your upper extremity and lower extremity muscles to push up. And then sitting back down in the chair, you're just going to once again shift your weight forward, use your lower extremities and have them stabilize you and control the movement on the way down in a fashion as such. For individuals with OA, this movement, or I should say these movements of standing up from a chair and sitting down back in a chair, are going to be difficult for them just because of the nature of their disease. The cartilage breaks down and that leads to joint inflammation and joint stiffness. They're going to have just an amount of pain that they experience going through that range of motion. The range of motion is also going to be decreased, and they're also going to have decreases in strength in their muscles around the joint. And they're just going to present with significant overall functional loss and have inabilities to do these tasks like sitting and standing from chairs. So in an individual with osteoarthritis, they might have difficulty standing up from the chair because of their decreased muscular strength. They may not even be able to sit up from the chair, depending on the height that it's at, if it's lower or even a normal heighted chair. And they're also going to maybe have balance issues standing up, so they might wobble and lose a little bit of stability, making it harder for them to stand up too. And going down, since they have an increased distance from standing height to chair, they're going to bear a lot of weight in their joints through that distance, and it's going to cause a lot of pain, and they may not even be able to sit all the way down. So the modification that I would make for individuals with OA, particularly knee osteoarthritis, as seen in this example if they're experiencing it, is to utilize chairs that are higher, such as stools, or like this chair that's adjustable here. We adjust this, it goes up just like that. This is going to make it easier for patients with OA to both stand up from the chair and sit down. So standing up, they have less range of motion they have to go through, and the muscles aren't working as hard as when the chair is lower. And sitting back down, the same thing applies. And also the decreased weight on their joints is going to decrease their pain levels. And you can utilize a cushion too to increase the chair height. This is going to help relieve those symptoms and make it more efficient for them to stand up from chairs and sit down in them too.